Everyone, I'm here to tell you a little bit about what we're going to be doing in the next several weeks. What I thought I would do is to help you understand what these individual personalized video recordings are and what we'll be doing as you work through each of them in your groups. If you will take a look at the discussion question that will be coming up in week 2 and several of the weeks that follow, you will see some specific instructions on what to do and how to make those particular vignettes, as I like to call them. Well, in a sense, because that's what they are. They're snapshots of individuals' lives. And because that we only have snapshots, we're seeking out more information to discover what diagnosis or what treatment plan or even objectives we're going to take care of for the particular individual patient at hand. So take a look as soon as the week is revealed, and you'll have an opportunity to review all of those criteria. For now, I want to try to help you with that clinical map that Letourneau always talks about and how important that clinical map really is for you as you begin to explore how to use the DSM and as you look at your text and also the vignette that is before you as you listen to it on the audio recording. First of all, you want to make sure that you work in your group and sort of discuss the particular vignette and see if you can't come up with as many discussions or possibilities that may arise for that particular patient. You will have other people in the class responding to your particular group, and you also will be going out to other groups and responding to them. Bear in mind that the more of these that you listen to and practice being the diagnostician as well as the clinician, you'll get better and better at them. Also, keep in mind that you may not have all the information you need. That is often the way patients come to us. While we love to read what's in the textbook and we know what the DSM might say about specific illnesses or issues, we have to look at the patient as a whole. And we also have to ask questions about what it is we need to know about that particular person. Before we go about putting a label on that individual, think of it. If you're really having problems with hypertension or even some sort of issue with your thyroid, you wouldn't want to be labeled bipolar. So it's very important to think about those issues as you go through and analyze each case. Trust me, as you work through them each week, you're going to get better and better. And don't forget, the more you read and listen to each case, the better you're going to get. Whatever you do as a clinician, whether you are responding to other posts on the discussion board or whether you are discussing a particular vignette that you have listened to in an audio recording, try not to make assumptions about what you do not know. It is so important to get as much information as possible so that you provide the correct diagnosis. And so that's where we'll begin. The diagnosis, what is it? And what objectives of treatment do we want to get for that particular patient and why? Also, what assessments are needed? For instance, you don't want to do psychoanalytical if it's really something psychological that can be managed. The clinician wants to look at the various characteristics, traits, or issues in each case. And they want a locale of treatment. What kind of treatment? Is it going to be in a hospital situation? Will it be outpatient? What will it be and why? Then you want to look at the interventions, if those are necessary, that need to be used. Emphasizing the treatment, cognitive, behavioral. What? You want to make sure you have a very clear path for your patient. The nature of the treatment. Is it individual? Is it going to be a couple, a family, or even in a group? What do you need to do for this patient and why? Timing, frequency, place, duration. What types of therapy, appointments, or treatment functions are going to be required, and making sure that you record them accurately and appropriately and professionally. Are there going to be medications needed? If so, why? Why would you recommend one or the other? Or what will you do if you, as an LPC, for instance, are not licensed to issue medication? How will you manage that situation? Also, looking at various services, like adjunct services. What does that mean? Does a person have a support system in place? Does the person need a support group in place? Something that will help that patient toward wholeness. You are that guiding ship that will help that patient find those particular oases in the journey of his or her healing. And last but not least, you also want to talk about that prognosis. Where is that prognosis in terms of the global functioning? Is it high executive functioning or low? That's going to help you determine what types of inpatient or outpatient treatment the person may need. You're not going to be expected in the very first one to be able to label and write about everything, but you do want to take some time to learn and practice with each one. It cannot be stressed enough that listening to those vignettes or those audio recordings of each of the individuals will give you much better practice and much more ability as you continue to work through the particular treatment or issue with that particular patient. Now, as you get prepared to post your responses on the discussion board, make sure that you've provided a list of references. Also, ask yourself, what else needs to be? What else do I need to know about the patient before I come up with any kind of recommendations? Then, list everything in your discussion and place it right on the discussion board. There's no need to make an attachment. Go right ahead and put it out there so that everybody will have an opportunity to read your responses. This part of the forum will serve as your initial post when you go in and write. It is extensive. You don't want to be superficial. Remember, you're dealing with a person's life. And while this is just a laboratory, it is still the place where you have an opportunity to hone those skills and make them excellent. Also, you want to respond to at least 2 other people, or in some cases, maybe 1. It depends on the direction for that particular week. Just make sure that you review those directions carefully. When you have a good discussion going, and you'll see the discussion board will be very lively, ask questions. Ask people what they might do if X, Y, or Z happens to a particular patient during treatment, or what might be needed in addition to what information is already provided. Also, be sure to review the grading rubric in your syllabus. I'll stick closely with it, and if you have any questions, feel free to ask me. In the meantime, now the fun begins. True, it is fun because you will learn so much, but remember, we are always practicing with someone else's life as we engage these discussions. Be respectful. Think about a person who has come to you and try to keep it in that particular environment and in that particular setting, even though we are only in a laboratory. I am sure you're going to find this section very, very meaningful. See you soon on the discussion board. Have a great night. Bye.